Glaucoma. Glaucoma is considered when there is an increase in intraocular pressure and optic disc damage and also visual field effects. Out of these three, at least two should be present for the diagnosis of glaucoma. So now comes the classification part. Glaucoma can be divided into primary and secondary. Primary, in which we don't know the cause, and in case of secondary, where cause is known. In case of primary, we just give anti-glaucoma drugs to decrease the intraocular pressure, and in case of secondary glaucoma, we treat the cause. So the primary glaucomas, or primary open angle glaucoma, primary angle closure glaucomas, or primary glaucomas. So first of all, primary angle closure glaucoma. It occurs when iris mechanically blocks trabecular meshwork and ciliary body face. So either iris pushed from behind or pulled in front. So the definition part is a condition with more than 180 degree of iridotrabecular contact with peripheral anterior synecdoche with raised intraocular pressure with optic neuropathy. So in the clinical classification is also there, in which we can subdivide them into subacute, acute and chronic type. Now comes acute angle closure glaucoma. The risk factors for acute angle closure glaucoma are middle-aged women, hypermetropic women. So there will be late night attack. Also there will be mid-dilated pupil, and pupillary block will be there, and sudden rise of intraocular pressure can be seen. The signs and symptoms are colored halos, sudden loss of vision and frontal headache. The signs will be closure of angle, conjunctival injection, increase intraocular pressure. The pupil will be oval, mid-dilated and non-reactive, and there will be Vogt triad in acute angle closure glaucoma, in which iris atrophy will be there, pigment dispersion will be there, and glaucoma flecans can be seen, which are the necrotic patches of lens capsule. So now comes the visual field effect part. The visual field loss occurs only when the optic nerve gets involved. There will be glaucoma always damages arcuate fibers preferentially. That's why nasal field loss first. Now comes field effects. There will be we will be discussing about the field effects. One is paracentral scotoma. It is the earliest field effect of glaucoma. Second one is Jerem's scotoma, which occurs on the Jerem's area. Next one is will be generalized constriction of the field. Next is bearing of blind spot. Next one is nasal step, which is characteristic for glaucoma. Next one is Siedel's scotoma, which is sickle's shape. Next is arcuate scotoma, which is in the shape of an arc, and one is temporal wedge effect. So basically there is no order of field effects, but thumb rules is there, in which the scotoma or loss of vision will start always from the center, and the earliest visual field effect is paracentral scotoma. Now comes the optic disc signs in glaucoma. The cup disc ratio is equal to or more than 0.7. Asymmetry of cup disc ratio more than 0.2%, and disc pallor will be there, splinter hemorrhage and will be there, focal notching can be seen, nasalization of vessels will be there, laminar dot sign can be seen, bionetting sign can also be seen, and there will be peripapillary atrophy. Now comes the treatment part. Open angle glaucoma can be managed conservatively with drugs, and also surgery can be done. Initially we need to decrease the intraocular pressure first, so it can be decreased either by increasing the outflow or decreasing the production. The outflow can be increased by the help of cholinergic agonist and prostaglandin analogs, and the production can be decreased by pilocarpine like drugs. So the surgical part, in surgical part we can do trabeculectomy, or we can also do trabeculoplasty by the help of argon laser, which is known as ALT, argon laser trabeculoplasty. Then other drugs which can be used are beta blockers like timolol, and adrenergic agonist can be also used like epinephrine, and alpha 2 agonist can also be given like apraclonidine and bremonidine, and we can also use carbonic anhydrase inhibitors, which are acetazolamide like drugs. Sometimes we can also give prostaglandin analogs, and hyperosmotics like mannitol can be also used to decrease the intraocular pressure. Now comes the treatment part for angle closure glaucoma, where we can do peripheral iridectomy or laser iridotomy with the help of Nd:YAG laser, and the drugs which can be given or all are beta blockers and alpha 2 agonists and carbonic anhydrase inhibitors.